Reach out with health, reach out with hope, changing hearts with every show, from the stories that we tell to the hands we teach.
A very good morning to you, and thank you for joining us on the program Health Connect Forum, powered by Reach Out Health Awareness Foundation, popularly known as ROHI. It's another beautiful Wednesday morning, and we're here. Remember, the program broadcast on Municipal FM 95.3 Abuja, and we relay on Amak Community Radio in Karishi. So if you're listening to us within that axis of the Federal Capital Territory, a big thank you for joining us. My name is Ebo. I'm your host. And if this is your first time, I'll tell you about the program Health Connect Forum. It is a public health education and awareness program dedicated to informing, educating, and empowering Nigerians to make better health decisions. Today, we focus on a public health issue that continues to generate concern, speculation, and sometimes fear, not just across Nigeria. This includes Africa, if you're following developments. Well, recent Ebola outbreaks in parts of the continent have once again highlighted the importance of strong health systems, community awareness, and timely public health responses. While Ebola remains a serious disease, public health experts agree that fear, misinformation, and stigma can often make outbreaks even more difficult to manage. Sounds familiar? For many Nigerians, especially those living in both urban and rural communities, here are a few important questions that may be turning around your mind. What is the current Ebola situation in Nigeria? What is the current Ebola situation in Africa? How much of what we hear about Ebola is fact, and how much is fear? Could Nigeria face another Ebola threat? How can families and communities protect themselves? What role do government agencies, health workers, NGOs, development partners, and community leaders play in preventing outbreaks? How can we respond responsibly without creating unnecessary panic? Well, this and so much more we'll focus on today. The topic is Ebola in Africa, separating facts from fear and protecting our communities. Joining us this morning to discuss this very important issue is Dr. Angus Ikpe. I hope I got that right. Ikpe. Yeah. Welcome to the program. Dr. Angus is a respected public health expert with extensive experience in disease prevention, community health systems, public health education, and emergency health response. Doctor, thank you for joining us today.
Yeah, thank you for inviting me.
Let's begin. Recent Ebola reports from parts of Africa have generated concern among many Nigerians. What is the current Ebola situation on the continent, and how concerned should members of the public and our immediate communities be?
Okay, so Ebola is in the news again. Okay, but this time around, it's just still located in DRC Congo, where they've had over 300 cases, and they've had over 20 deaths. It's also spilled over to Uganda today, where they also have some 20-something cases and over 10 deaths. So the situation right now is that Ebola there's an outbreak of Ebola, but in DRC Congo and in Uganda, the World Health Organization has declared Ebola a public health emergency of international concern. That was around the middle of May this year. When the outbreak came up. And so what they are saying is that everybody should be at alert because of travel risk. These things can spread. We've seen it before. It's the last time we had Ebola in 2014. It came over from other countries in West Africa from Liberia specifically down to Nigeria. And that's how we had some 20 cases or thereabout in 2014. So the situation today is that there's Ebola outbreak in DRC Congo, a little spread into Uganda. It's mainly in some province in DRC Congo. Probably the nearby areas of Uganda actually have gotten a bit of a spread, but so far, no confirmed case of Ebola in Nigeria.
So far, no confirmed case of Ebola in Nigeria. All right. Now, having given us that overview, take us deeper. For our listener who has no idea exactly what is Ebola.
Okay, so Ebola is a fever-like disease. A disease that comes with fevers due to an infection of a virus, the Ebola virus. So, you have bacteria, you have viruses, you also have malaria. So Ebola is a kind of disease that feels like malaria in terms of the fever it causes, but it's a very severe one because it tends to, it's what they call case fatality rates, about 50%. So a disease that can kill about 50% of people.
When you say case fatality rate,
that's why I'm trying to explain. So a disease that has the ability to kill about half of the people that actually suffer it is a very serious disease. And when a disease also has the ability to spread very quickly and so many people suffer it. So when we talk about burden of disease, we want to look at both the severity of the disease as well as the number of persons who can be affected by it. So you can see that Ebola can spread and it kills, about half of the people, that's if it's left unattended to.
Okay.
But of course, if you get early treatment and all of those, you get support, the numbers actually go down. For instance, you've had over 300 cases in DRC Congo, but the deaths are just over 30. Okay, so you can see that with intervention, you can actually bring down. So it doesn't kill as much when something is done, but left unattended to, about half of the people who suffer from Ebola can pass away.
Okay, so let's put light on how Ebola spreads. Can I get Ebola by simply having physical bodily contact with an infected person? I mean, for the typical person who is listening in the community, can I get it by sitting with an infected person in a keke? Moving from one point to another. If somebody sneezes, should I run away? If somebody has fever, should I run away? How does it work?
Okay, so Ebola, of course, because of the ability to kill, like the fact that case fatality is high, that first of all brings about fear. And so, but in terms of how you get Ebola, one thing that should be clear to everyone is that you need a sick person, okay, to transmit Ebola. That person has to be sick and then become symptomatic, okay, to probably start producing bodily fluids. Okay, so when the person, first of all, someone that is not symptomatic just has Ebola, not just the fever, but now producing, vomiting, stooling, having a rash and all of those things. At that point, their body fluids can, cause infection when you come in contact with it. So Ebola is not COVID. It's COVID usually transmitted by people coughing, sneezing, talking, singing, whatever.
Okay.
But for Ebola, you need to be sick. Okay, and you need to be exuding some body fluids. Okay. So at that point, usually you won't find sick people in keke. That's what you will not find in taxis, in buses, wherever. Okay. People won't be that sick and still be in those. So people will usually be vomit at that kind of stage. When it gets to that stage, at the early stages of Ebola infection, it's usually not transmittable. That's what is known. So, but when people start exuding, that's why people at greatest risk are usually family members who would usually care for a very sick person, having to support them when they are vomiting, they are stooling, taking, trying to remove vomitors, trying to, if they pass stool, and so on. And then the health worker in the hospital, who is also going to be dealing with a very sick person. So when those body fluids are all over the place, so Ebola, attacks the body. Then at some point, it starts to want to leave the body through these body fluids. So it's at that point where you now have so much, there's vomiting, there's stooling, even from saliva at that point, all of those things are infectious. If you don't touch them directly on the sick person, it might be that their body fluids has contaminated surfaces. This risk is high for people caring for sick people at home. It's high for health workers who usually have to deal with. By the time people are that sick, they're usually in hospital or they're home being cared for. They wouldn't be in buses. A very sick person like that won't be going to work. So the fear, shouldn't be there. That's okay. When you're just on the road, you could get. But if it were COVID, you could get COVID anywhere.
Okay, so let's touch two things. Between COVID and Ebola,
Yeah.
so it is easier for it's the transmission rates for COVID is higher,
Much higher.
compared to Ebola.
Yes.
So we have less to worry about.
Yes.
Care number one, concern number one.
Without
dealt with.
touching.
Without touching.
That's why there's a 2-meter distance. Stay close by. Somebody
Okay.
just coughs. In fact, you can enter an elevator where somebody has just left, and then you can catch COVID. Although,
but that's not the case for Ebola.
No, that's not. No. You can. That can still happen because if the person is so sick, has vomited, his hands are contaminated, and he holds onto things, and you come and hold onto those things too, and then you now put your fingers in your nostrils, or you don't wash your hands, and you go on to eat and all of that, so you can get Ebola transmitted.
We will talk about all the things you need to do or know to help you stay safe and free of Ebola should it get to Nigeria.
Certainly.
But however, I'm concerned because we're talking to communities here.
Yeah.
We're talking to families. What if a family member is infected, let's say between a parent and a child or children, between a husband and a wife? Let's say a husband is infected. Naturally, by our culture, the wife will stay back to care for the husband, the sick husband.
Yeah, that's what's expected. So the thing is, you need to have a high index of suspicion. When you say Ebola, they say it's a hemorrhagic fever. Hemorrhagic means it can lead to bleeding from orifices. Okay, from the nose, from the mouth, the bloody stool, and also on bloody vomiters. You can start bleeding from all the places that it's easy to bleed from. So that's one thing we use to recognize Ebola. It can cause, but there are other things that can also cause bleeding, like Lassa fever and so on. It's also a hemorrhagic fever. So, but for Ebola, first of all, you will get to the first stage where it looks like malaria, it looks like flu, it looks like, so it says a flu-like illness, okay? It usually causes fever, it causes headache, it causes sore throat, it causes body pain. These are all some of the things that you see with malaria, and other common viral infections, okay? So when that happens, that's not when you probably be able to identify, but that's where you start to suspect. See, any person with a fever and flu-like symptoms could well be a case of Ebola. You also want to ask, where is this person coming from? You already know that, look, we have DRC Congo, you have Uganda, so you have, Central Africa, those kind of areas. So you want to, if you know the travel history, if you know this person traveled in, you could be concerned. Okay, so there are many things that, so first of all, the symptoms, travel history, and so on. But where it now becomes a real highly suspected case is when you start to have vomiting, diarrhea, rash.
Bleeding?
Bleeding is even towards the head, so you may not quite see. So despite the fact that it is
so we can call
fever,
these early signs to look out for.
Yes, early signs will be, first of all, there's a clear fever.
Okay.
It's unlikely that, for a lot of infections, you can have a spectrum of, as in severity, right? You can have asymptomatic, no symptoms at all. You have the Ebola, it came in, and that's how some people actually got it. Very little exposure, so they don't really come down. Those people are not infectious. Then you can have those who have a mild infection. So those ones too will not be infectious because they will end up with only the flu-like symptoms and it will go away in a few days.
Okay.
Then you have those who have a severe case where they will come down with the flu-like illness. They will end up with vomiting, stooling. These are the spreaders. Okay? Vomiting, stooling, body fluids, very sick people. Bleeding is towards death. So if you're waiting for bleeding to recognize Ebola, then you'll be getting it very wrong. So you don't want to say, okay, we saw fever and now there's bleeding, and that's when we know, this is a case of Ebola. No. So by the time you start having the flu-like illness, you have vomiting, stooling, you have rash, and then maybe a travel history that is suspicious. Okay. So that's a very, suspected case. Highly suspected case, highly suspicious case. So that's how it goes. But start to suspect Ebola from even the fever.
Okay.
Yes.
Before we go to the next layer of this conversation, let's look at fear and facts. Do you think that we have succeeded in dealing with these issues, whether as communities, whether as government agencies, as individuals? From your experience, have we?
First of all, I'll say, sometimes we're very concerned. Yes, we're trying to say, we're trying to, ensure that the fear doesn't affect us that much. But you also look at the other side of things. Do you think that fear has also helped us to take action?
Okay.
Do you think that fear has caused the government to also, respond quicker? Right now, our National Assembly, members are already asking for better funding for the NCDC. It is out of fear. Okay. So fear has its positive sides, and fear also has its negative sides. So, and I like the fact, because we succeeded. Nigeria showed a very good example of emergency response in 2014. Really? We were able to contain Ebola with very good contact tracing, community engagement, the support services. Of course, the cases were not many, but all of those things were done, and even the government did very well to have funded that process. So I mean, the fear is I said positive and negative sides, but you see, the reason for the fear is also because of the case fatality rate. Okay. When you hear something is very deadly, of course, it evokes fear. But what you shouldn't have is misinformation. Because the fear shouldn't get to a point where you say, oh, somebody has a fever in the class and Ebola case, stigmatized Ebola, and so on. So you don't want it to get, you want to make sure that people understand exactly how Ebola is transmitted. Okay, that's risk communication. Okay. You need to know what is the risk. People need to understand, people need to be told who is at risk of contracting Ebola. Of getting Ebola, who is who and who. So healthcare workers are the people that are supposed to be most vigilant right now. And then anybody who has a very sick relative, okay, we've said flu-like symptoms. At that point, if you call it malaria, of course you go see your healthcare provider and so on. But once the illness starts to get to vomiting and stooling, that's where you start talking about isolation.
Okay.
That's if you haven't already gotten, confirmation that it is Ebola. Because what people should do is, early seek care. Go to the hospital, go and see your doctor early enough when you have the flu-like symptoms. Some flus will go away in a few days, right? So if your symptoms start to worsen, of course, you go back again to say, this is what I'm seeing. And then whether it's relative that first sees the vomiting and stooling and rash, or it's the health worker or the doctor or so, immediately they want to, isolate. They don't want to. So, of course, around our borders right now, we're going to be looking out for the first things, which will be fever. Those who are, so the screening of temperature and so on may resume. Okay. All right, so that we start to see, because if you have people who have fever, you probably want to monitor them. Even if you don't quarantine them, like hold them down and keep them for the duration of the incubation period of the disease, okay, you would want to at least follow them up as they go to where they are going. So probably some public health person is checking on them regularly to say, how are you doing today? What's the situation? Because even during 2014 Ebola, we did that. They couldn't actually achieve quarantine for everybody. Okay, they allowed some people go, but they just restricted their movements without absolute quarantine. Okay. So for some, they still just follow them up at home. So that's one way to, you look at the symptom and the how things how things turn out. From the fever, headache, body pain, sore throat, all of those things, and watch to see whether things get. It could be a case of Ebola and it will go away.
Okay.
Our concern should be who is a transmitter of Ebola. That's what the public needs to understand.
How do you know who is a transmitter?
I've said it several times here. I said it has to be that person who is very sick, and now exuding body fluids or bodily fluids. That's the person who is a transmitter, the person who is vomiting, stooling. So if you see anybody vomiting and stooling and started having the fever some days prior to that time, no fever, we came from a party and somebody's vomiting and stooling, no fever at all, it could be food poisoning. So, but if you see vomiting and stooling, you see rash, all of those things after a fever, then that's a case that's where isolation should happen even before you're able to confirm the case of Ebola. So they say report a suspected case.
Okay.
So at what point do you say, at this point you cannot say every fever is a suspect. Well, there's levels of suspicion. So you should start to suspect from every fever. and then you watch, how things.
Okay.
You go from there. Yeah.
Well, the last question I asked deliberately. On radio, you say it, and you say it again. There's always someone who's just joining us who maybe didn't hear it the first time you said it. But before we go on our first break, if you're listening, this is Health Connect Forum, where we discuss health issues. And quickly, our guest here this morning is Dr. Angus. Dr. Angus is a public health expert. This is his stuff. And you can tell he's done justice so far to the issue. But we'll continue, and then you can join the conversation after the break. The number will be 091-2259-6595. That's the studio line. 091-2259-6595. But before we go on that break, Dr. Angus, which group of people are more susceptible to Ebola infection? Or is there a group of people that are more susceptible to infection?
Of course, you look at health in a spectrum. Generally, anybody who is very healthy would be at lower risk, not susceptible, but will be at lower risk of suffering, serious as in damage from the disease. Okay. What is it susceptible means whether you can catch it at all. Okay. So Ebola, especially when you look at the fact that why Ebola actually was spreading and the risk is also high is that when an infection is novel, when a virus is novel in a community, people don't have pre-existing immunity. There's so many things, so many illnesses around the community, infections that from childhood, from the mother, you start to acquire some immunity to. So as time goes on, so your level of immunity determines your susceptibility. So, but for Ebola, almost nobody had in 2014 had any kind of immunity to Ebola. So a very novel virus coming into everybody is going to be susceptible, because you don't have prior immunity to it. Okay, so nobody's going to say, okay, this person is not likely to have Ebola despite exposure. That's not the case because it's. But when diseases, for instance, Lassa fever can come in, and some people will not really catch Lassa fever. Why? They already have some immunity. They've been exposed before. Lassa fever tends to be endemic around certain parts of Nigeria. So that's for some persons may not. But I was talking also about how the disease affects you. So those who probably have other health problems, who's have reasons of maybe age and so on, either too young or too old, those people will usually suffer more. People who have like pregnant women will tend to. They used to say pregnant women will hardly ever survive Ebola. Reason is that during pregnancy there seems to be some effect on the body's ability to fight infections, and such that they seem to be more susceptible. In fact, certain illnesses, like we used to say about things like appendicitis, appendicitis can kill a pregnant woman. So they don't even get to look at whether the baby is going to survive or not. They just make sure they deal with the appendix because the infections may not be controlled by the body's own ability to fight it. So in terms of susceptibility, except within DRC Congo where it's been like something that occurs over and over again. So over there might be people who have some immunity.
Okay. Thank you for staying with us. This is Health Connect Forum. We're looking at a very critical conversation this morning, and you too can join the conversation after the break by calling 091, take down the number, 091-2259-6595. That is 091-2259-6595. Do the call in and join the conversation if you have a question, a contribution, or a comment. We're discussing Ebola in Africa, separating facts from fear and protecting our communities. Don't go anywhere, we'll be back. Thank you for staying with us. The program you're listening to is Health Connect Forum, brought to you by Reach Out Health Awareness Foundation. This morning we're discussing Ebola in Africa, separating facts from fear and protecting our communities. Our guest is Dr. Angus. Just before we went on that break, we've talked about of course, talked about what Ebola is, some of the early signs to look out for, what to do and what not to do. We've talked about fear and facts. Before we now start to look at preparation, response, especially from the Nigerian front, taking a cue from what is happening in Uganda and Kenya, I'll ask the question, from experience, which group of people are vulnerable to Ebola infection? Very important.
Yeah. So the other time you talked about susceptibility and that addressed that. Now when it comes to vulnerability, that is those who are at greater risk of even catching the infection. Of course, it will be, like I said, since transmission occurs from those who are very sick or Ebola cases who have already died.
Okay.
So it's not only sick people. You also look at the corpse as the dead. Okay. So so sick people, first of all, family members who probably stay at home to care for such people who are quite sick, vomiting, stooling, exuding bodily fluids. Those things those are things that will cause. So those are people at great risk because their exposure, you can't even check it because they're not even professional health workers. They won't protect themselves. They won't do anything. And then the next group will be health workers. Because even though health workers have infection prevention and control measures that they should follow for every disease, working in the hospital, okay, you should protect yourself. You should protect other patients because health workers can contaminate themselves. They can also contaminate other patients.
Okay.
And somehow it seems that kind of thing happened in Nigeria from how things were transmitted, because a nurse working touches this patient, does not ensure that she discards everything used and protects herself and goes to the next patient, carries the thing so she transmits the infection as if it's a formite, some object or something. So she carries her gloves and so on and touches the other person. So sharing gloves within people can carry even from not only the nurse who is at risk, putting other patients at risk within the same healthcare setting. So caregivers at home are at very great risk. Health workers are at risk. Okay, even though, because like I said, they're supposed to prevent it, even if it happens abroad, right? Because we've seen it with COVID and some other illnesses. Transmission still happens. There's nowhere where it's perfect.
100%.
Yeah, it's nowhere where it's perfect. But in certain settings, sub-Saharan Africa, it might not be as good. People know what they're supposed to do, but of course, maybe gloves are not there, maybe certain things are not there, maybe certain protocols are not being followed, nobody's monitoring and so on. So that can cause them to be at greater risk. So apart from health workers, then someone has Ebola, very sick, nobody says anything, caregivers at home have probably gotten infected. Then there's a burial. Okay? And then so
people gather,
maybe help to carry the corpse, go ahead, the burial processes. So these days there are guidelines for safe burial practices. So we still need to go back to those things and make sure that when some people, especially suspected cases, die, we are very careful with the burial processes. So that's another. So at burial, that's another place where you have risk, especially those who handle the corpse.
Okay.
Yeah.
Now, we've talked about all the risk. We've talked about facts and early signs, symptoms, and all of that. Let's bring the conversation home. Preparedness.
Yeah.
Is Nigeria ready for another Ebola outbreak? Yes, it is not here yet, according to facts or information available. But of course, you don't need to wait for the house to burn down.
Yeah.
Before you fetch water.
Okay, so I think we'll start from lessons from the past. At that time, Nigeria wasn't so ready. And then there was Ebola. And then look at how it turned out. We were able to contain it.
Okay.
There was government commitment. And then, there was funding, there was efforts, there was emergency response, and then it worked. So today, they said the risk of us, having an outbreak is... I think about 59%. I don't know who did that assessment, but I saw it. So about 59% risk of us having an outbreak. Why? Because of our porous borders, because of travel. People travel a lot.
By your assessment, is that high or manageable?
Of course, is high, and it is high at 59%. It's high, but what's the issue is not whether you can. You just need to increase the alertness, okay, and then the actions around the borders that you can actually control, okay. So that will help you reduce your risk when you're able to do something about, because it's about people leaving Uganda and leaving DRC Congo to come into Nigeria. That's the only way you're going to get it, or somebody's bringing bushmeat from that end, but that's very unlikely. So we have porous borders and all of that. So the risk is there, okay. But in terms of preparedness, Nigeria has better surveillance systems today. First of all, from Ebola experience, because Nigeria was an example, and we had to go and help quench the Ebola around Liberia, Sierra Leone, and the other countries that were affected. Yeah. So today Nigeria has that experience. Nigeria has the systems have improved. Then look at COVID, where every other country in the world got to learn. I think every country is better off in terms of what's it called, monitoring and all of that. So our systems are a bit better. Our laboratory capacity is also better. Because COVID particularly made us to have the ability to be able to test for so many viruses and so many things today. So if that happens, COVID is the type that can possibly enter many states at the same time. But for Ebola, it usually be a bit focal. Okay, so the kind of response we have today in terms of laboratory capacity and so, those ones should be able to contain whatever we have today. And then we've learned, we help to develop protocols for Ebola control in other countries. So I don't think we should be, but of course we should take the necessary precautionary measures to make sure that it doesn't even come in the first place. So that begins with our borders. Yeah. So so one of the things we need to be doing now too
do you see
community sensitization? Yeah.
You talk about the border. Do you see government taking action in that direction?
Of course, if when you start to hear from the political class, beginning to talk about you taking action, you can understand that that's where you have political will. Okay. So once you have
that's a good thing.
Very good thing. And like I said earlier, sometimes also evoked by fear. It's evoked by fear. So, but it's a good thing that it happened. So 2014, they responded very quickly with very good funding. So at that time, and it really made a difference. And all around the world too, there was other development partner support. Everybody rallied around the African countries that were affected, and they came in and made sure that it was such a collaboration that really worked very well.
Okay, so this is
it's not a pandemic. Sorry,
indeed.
There's a pandemic, and when it's a pandemic, everybody's suffering. All around the world, so nobody has that amount of time to, go and support others. So, but in this case, it's an epidemic. It's a bit focal, and so everybody jumps on it, and then something. But we probably did it quite well. I think there were slips in Sierra Leone and where it started. There were slips. So before they knew it, it had gone out of control. Otherwise, they too probably would have had a chance to stop it. Yeah.
So
and then they have weak health systems in some of those places.
One thing there, a pandemic and epidemic.
Yeah.
Two things you need to keep in mind and focus. Maybe it will help you understanding of how these things work. The reason why we're here is because this is Health Connect Forum. Of course, there is indeed the need for... We have a caller on the line. All right, let's bring it through. Hello, good morning. Hello, good morning. Is the caller there? All right. So if you want to join the conversation, you have a question or comments, do well to call the number 091-2259-6595. And we'll do the best that we can with our guest here, Dr. Angus, to respond to your questions and comments. Once again, the number is 091-2259-6595. That's the number to call. Quickly, moving on. If there is a confirmed case of Ebola, do we have a call on the line? Good morning. We'll come back to that question. Hello, good morning. Are you there? All right. maybe network issues because of the weather. 091-2259-6595. Or better still, you can go to the Municipal FM social media pages and drop your comments there. I trust we'll get the questions through to our guest and he'll respond to them. If Ebola, Doctor, is confirmed in a community today, what should members of that community do? If Ebola breaks out in Kareshi or breaks out in Apo today, what should the residents of Apo do? What's the first line of action?
Okay, the first thing is listen out for directives from the health authorities.
Okay.
Because you need to know what the situation is. And it's their responsibility to say, okay, this current situation, we have one case around, if they choose to, locality. Okay, so we have that one case. We're going to be doing contact tracing. We're going to be finding out all those who have come in contact with that person. Okay, because that really helps the situation. Anywhere you find a contact, whether the person has moved, you want to go and follow up that contact. Not that the contact is already a transmitter, but you want to make sure that you monitor that contact so that if eventually that becomes a case, you quickly just cut it off there. Okay. So the capacity, the effectiveness of contact tracing is one major thing. But the first thing is engaging the community.
Okay.
So it is the responsibility of government to do that, the health authorities to do that. So whether it's the community health, because healthcare starts from the health center and it's community health workers who have responsibility to take care of their community. So they're supposed to dish out information, but this is probably beyond them. So you're likely to get this thing first from the state level, the state ministry of health. And if they have a disease control agency there, they're the ones that are probably going to give out this information. Of course, the Nigerian Centers for Disease Control is also there. That's usually leading all this. Of course, if you have Ebola in Nigeria today, whether it's in one LGA, one community, it's going to be the NCDC that's leading. So you're going to get communication from them. If you don't hear from the radio or from yours, you can go to their website to go and find out what is happening as per the Ebola situation in Nigeria. And it is from there, if you check up till last night or so, there's no confirmed case of Ebola in Nigeria. So that's the situation. No confirmed case. We don't know whether any case has come in, but no confirmed case. So you said okay, what the community people, what they should do?
Yes, first line of action. Go ahead.
Okay, so the community, every community has some leadership and all of that. So, but it comes from the government actually. But the community itself, they need to seek information, which is what I've said.
Make sure it trickles down to
it's still the responsibility of the health authorities to ensure that there's sufficient community engagement, going through the gatekeepers and making sure that information flows and all of that. So, but the community should avoid, spreading rumors and false information about what Ebola is and what Ebola is not.
What can happen as a result of that?
Yeah, because unnecessary panic will cause people not to take certain. For instance, somebody will say, "Oh, there's a sick person in that class. My child shouldn't go to school again because we heard that one of that child was having fever today. So don't go to school again. Child misses school and all of that. At work and so on, people probably could avoid. We cannot crowd ourselves inside the vehicle again because we think that Ebola is going to be transmitted. And so when you have false information, and then people could have certain symptoms and go and start doing remedies that they shouldn't do and put their health at risk just because they've seen a fever or a flu-like illness, or somebody no fever, nothing, just vomited this morning and say, it's Ebola. You need to take a lot of salt, and somebody could take so much salt and you pass away. So the information about the risks, what is Ebola, what are the symptoms, who is at risk, all that information needs to be, but it is not the community that will do that by itself. It's going to be the health system.
Now, let me ask you, can members of the community trust the government to bring not just information, but also the care, the support, the facilities? It's one thing for somebody in the village or the remote area to present any of these symptoms, and you go to the nearby community health center and they tell you, no, the government is yet to bring anything here. You'd have to go into town, maybe go to Garki, one general hospital in the urban center. Does this happen?
Yeah.
Where all of these wonderful services and support and care doesn't get to the local communities?
You see, Ebola is very different from some other epidemics, and like I said, it's a focal disease. It sort of happens in a way that you can almost take control of things. Okay, because you see, if you can trace and see, oh, this person is a case, and you can follow up things and so on. So the community's responsibility or the people's responsibility will be to report a suspected case. But like I said, it has to come first from telling them what's the suspected case, who is suspected, who is at risk of transmitting, and so on. So the community would need to report cases through maybe any hotline that is available. Otherwise, you go to the nearest health center, or you call the state Ministry of Health, or even the Federal Ministry of Health, or the NCDC, or the state disease control agency. You will need to call. So now, in terms of trusting the government, the situation is that for COVID, right? Every state is affected, okay? Even when you start having COVID cases, the treatment centers were overwhelmed. So some cases couldn't even get opportunity to be treated within the treatment center. Treatment centers were no longer free. There were things like deposits of 200,000, to enter a treatment center. So because the thing is not, was
that formal?
Health systems
was that
capacity.
Part of the plan?
In some places it was.
Okay.
It was formal.
Okay.
Because the government needed to be able to respond. But government has limited resources to be able to, so when the thing is everywhere. But for Ebola, it tends to happen in a way that it's, you see the whole country even focused on two communities where you have cases and where they're doing contact tracing and so on. So it's easy to respond to one emergency within one community or one state when other states are unaffected. The whole country will deploy its resources.
Is that where we are at the moment?
Yeah, now it's
should we have
just
an outbreak?
preparedness.
Preparedness.
Of course, if it happens, there's already action, being taken, point of entry, and so on. Community awareness, part of what the foundation is doing right now. Okay, like the foundation seems to be, doing what government is expected to do. And that's quite commendable because a lot of,
we've done a lot of work here already.
Good. So that's very commendable, So the government itself, I believe at this point, the Nigerian government is prepared. And even the National Assembly is asking for increased funding ahead of time. And that is likely to come with the political, will.
Support.
Yes.
So, critical question. We have one question here. I don't know, maybe for the weather's sake, the calls are not coming in through. But 091-2259-6595 is the number. I have one question here from a listener. But before we do that, quickly, in a few words, how can governments... Do we have a caller on the line? Hello, good morning. Hello, good morning. Okay, the call's gone off. All right, so how can government... NGOs and development partners work together in times or cases like this?
Yeah, okay. What we usually say is that government gives direction. Okay. Today in Nigeria, we tend to operate in a way that we all do work together. Okay, there's some joint effort. There's no fragmentation of what we are doing. So government already has its processes. Okay, it's emergency preparedness and response, plans and policies, and government is already, taking action. So, but we have development partners who are also working with government and civil society organizations, and so on, NGOs who are working with government in these areas. A lot of the partners already know the areas where they work, like your foundation now. So they're already working, engaging communities, communicating and so on. So working together, under disease control and health emergency response, that system already exists, where you have the NCDC leading and then development partners who are working in that area, also working together. So we usually work as, one forum, these days. And so you don't have people working at cross purposes, doing different things and so on. They usually have government leading and development partners, coming along, supporting with resources and all of those technical expertise and all of that. So in Nigeria today, the health system is quite coordinated in terms of every part.
Let me pause you there
of service,
so we can attend to this question from a listener. It said, can someone spread Ebola without being sick? Deborah from Garki.
Straight away, not at all.
Not
at all.
Fantastic. So,
Okay?
Deborah,
you need to be symptomatic. And symptomatic to the extent of producing bodily fluids.
Okay.
It is the body fluids that transmit the Ebola.
Okay.
So someone that is not sick, you can have Ebola infection, subclinical, okay, asymptomatic, no symptoms, and it's also happened with COVID. So many people, in fact, most of us had COVID without
even knowing it.
Yes.
Dr. Angus.
Most people.
I wish we had all the time, but I think this is going to be continuous work, especially as we remain vigilant in view of what's already happening across the African borders. But we may have to bring today's conversation to a close, trusting that we will continue to stay on the alert. As soon as events develop, we'll bring this conversation back to the table to inform, educate, and engage with our communities to ensure that they are better equipped to deal with an emergency should the need arise. We must say thank you very much for being on the program Health Connect Forum today.
Yeah, thank you very much.
When we knock your door again, you'll grant us access. And to you, the listener, thank you so much for being a part of the show. We'll be back same time next week, Wednesday. But if you want to be a part of the program for sponsorship, partnership, and participation, you can get in touch with us. Visit Reach Out Health Awareness Foundation official website, that is www.reachoutwithhealth.org, or call the number 0703 044 8318 or 0813 973 0664. I am your host, Imo Ebong. I'll see you next week, Wednesday. Bye for now.
From the stories that we tell to the hands we teach to grow, ROI stands for everyone, where knowledge lights the way. Reach out with health, let's make tomorrow safe.